have some video to show, I believe, some people rowing, and they say that's really good for your back, but I think if you do it incorrectly, it's not good. So your thoughts on that, doctor?
Right, so when you row, and in a lot of the exercises we do, we want to make sure we're strengthening the core at the same time or contracting the core. And you can see in this video here that she is totally sitting straight, and then as her back goes down, she's working the abdominal muscles and the back muscles at the same time, keeping her legs maintained to maintain her balance, and she's working just the core muscles there. So if you added a rowing machine to that activity, it would be great. It's aerobic conditioning, so it's good for the heart, it's good for the lungs, and it's also strengthening the back. And as you pull the arms back in like a rowing process, you're going to work the arms and the chest muscles as well. Here's an example. You have to do it correctly, though. Her back is entirely correct. See, it's straight. Maybe even arched backwards a little bit. You don't want to go forwards on that. You want to keep the back neutral spinal mechanics when you do it. So form is very important in these exercises. You don't want to hurt yourself. And so she is doing it exactly right.
And we even have some suggestions for some, low intensity activities, because a lot of people may not be runners or do things that are really, aerobic, things like that. So low impact is still very good, right?
Yes, absolutely very good. And if you have things like arthritis of the knees or arthritis of the hips or spinal conditions, you want to be low impact. You don't want to be jumping around. So walking for pleasure, gardening and yard work, housework. I give people prescriptions to do the correct amount of housework.
Oh, really?
But not too much, not too much. Dancing. A lot of my elderly patients love to go dancing, and I promote that, and they do it in a very healthy way, and they get a lot of benefit with their partner out of that. We prescribe home exercises. Everyone that leaves the office gets some home exercise to do, and I try to promote that on most days of the week. Golf is a form of exercise. We don't have badminton too much down here in Florida anymore, but that's a great exercise. Something where you're running, but not really running or sprinting, just moving quickly. Croquet, shuffleboard, lawn bowling, table tennis, these are all good ways of low impact activity to build up strength and endurance.